The content of this podcast is provided for general informational purposes only and is not intended as, nor should it be considered a substitute for professional medical advice. I am Karen Nickel, family nurse practitioner, and you are listening to Itchy and Bitchy, a podcast that provides answers to your many unanswered health questions. I have an acquaintance whose 16-year-old daughter has been diagnosed with something called AMPS, which stands for Amplified Musculoskeletal Pain Syndrome. And her daughter is seeing a neurologist, but her current regimen is apparently not providing any symptom relief for her daughter. I thought, since I will be sharing some treatment information with this concerned mother, that I should share it with you too. It could help a lot of children out there who are not getting diagnosed with this problem. AMPS, again, stands for Amplified Musculoskeletal Pain Syndrome and is a condition in which the person has chronic pain in the muscles, joints, or other parts of the body and occurs without any underlying injury or inflammation. Today, I'm going to share information with you specifically about pediatric AMPS. This is the syndrome that occurs in children. AMPS pain can affect the entire body, in other words, whole body pain, and this form is often called fibromyalgia. AMPS pain can also be localized to a specific part of the body, in which case it is sometimes called complex regional pain syndrome or CRPS. Sometimes, in addition to the pain, the limb involved will have swelling and will become cold and blue. The pain doesn't have to be present in the muscles and or joints specifically. It could also be present as abdominal pain, for instance. Other symptoms can include allodynia, which is pain caused by something that should not really cause pain, like a touch or putting on a sock. Other symptoms are headaches, cool skin or skin discoloration, as I mentioned, swelling, difficulty with movement, stiffness, or tremors. The pain episodes can be intermittent or they could be constant. It's called amplified pain because the pain that the person experiences is much more intense than one would expect. For instance, a child with AMPS can have extreme pain when given a hug. Oftentimes, a child is not taken seriously because the pain is so intense and it is not associated with anything that would cause the pain. So many people think they're just faking it. The initial onset of this syndrome can be triggered by an injury, surgery, illness, or stress, but the actual cause is not really well understood. AMPS occurs mostly in children, and 80% of those with the syndrome are pre-adolescent and adolescent girls. 80%. So it is thought that hormones may also play a role in the development of this syndrome. AMPS rarely occurs in children under 7 years old. To better understand what is happening with amplified pain, it helps to know what is quote-unquote normal pain response. If a child scrapes their knee, for instance, the area of damaged tissue sends a signal through the pain nerve to the spinal cord. The signal is then sent up to the brain, and the brain recognizes the signal as one of pain. This is a normal pain signal loop. In AMPS, there is a short circuit of sorts that happens in the spinal cord. So the normal pain signal travels up to the brain as it should, but it also goes to the nerves that control blood flow through the blood vessels. These are the nerves of the autonomic nervous system. We also know this as the fight or flight nerves. These nerves cause the blood vessels to constrict or become smaller, which restricts blood flow and therefore restricts oxygen to muscles and bone. This leads to an increase in lactic acid. The lack of oxygen and the lactic acid buildup is what causes the pain. This pain creates a new pain signal. So you have the pain, and then it creates another pain signal that also is short-circuited in the spinal cord, causing a further decrease in blood flow, which leads to more pain. This continuous pain signal loop causes the pain to become greatly amplified, super exaggerated, because it's just constant, a constant signal. Children with AMPS often have had a significant specific injury such as a broken bone, moderate to severe musculoskeletal injury, or have developed pain after surgery. The symptoms of AMPS can occur suddenly after the injury or take weeks to develop. The average time for the symptoms to develop is 3 to 4 days following the trauma. So when taking a medical history in a child like this, often, most of the time, we will see that the symptoms started shortly after some kind of bone or soft tissue injury. Illness is a less frequent cause of AMPS, but can occur after experiencing an inflammatory condition such as arthritis, tendinitis, which is inflammation of the tendons, or myositis, which is an inflammation of the muscle. Other illnesses that can trigger AMPS are infections such as mononucleosis, gastroenteritis, or influenza. Since COVID is a newer thing, COVID could very well end up being a trigger, but we don't have any data on that at this point. So again, if you have a child who had the flu or had mono, some viral illness, and shortly thereafter they started having all this pain in their body, that's very suspicious for something like AMPS to be developing. Stress can also be a complicating factor and a trigger for amplified pain. And it can be either negative or positive stressor and does not have to be a big stressor. Genetics or hormones may also play a role in the development of amplified pain. Having a family history of AMPS increases one's risk. As I mentioned before, 80% of children who develop AMPS are pre-adolescent and adolescent girls, so the onset of the menstrual cycle could be a trigger. There is no specific test for AMPS, so the testing that is done for children with these symptoms is done basically to rule out other causes of the symptoms. Lab work usually done includes a complete blood count, or CBC, a comprehensive metabolic panel, or CMP, and inflammation markers like sedimentation rate and C-reactive protein. Diagnostic testing usually includes MRIs and possibly a bone scan. Most of the time, the testing comes back normal in these children. Sometimes swelling of the bone will be seen on MRI or bone scan, but otherwise, it usually are normal findings. A provider with experience treating this condition can make the diagnosis with a physical exam and a full family and personal medical history. It is common for children to see multiple providers and go years before diagnosis is made. This is why I want to share this information with you, so that if you know of a child who is dealing with chronic pain that no one can seem to figure out, it is worth seeking out a provider who specializes in this diagnosis and treatment of this syndrome. I will talk about how to find such a provider later in the episode. And after this quick break, I'll let you know how this syndrome is treated. Be right back. I am super excited to tell you about a new company I found called FrameBridge. FrameBridge makes it easier and more affordable than ever to frame your favorite things without ever leaving the house. How many pictures, art prints, posters do you have stashed away and have been telling yourself, I really need to get that framed? I know I am not the only one doing that, and I don't get it done because I've got to go to a framing or art supply store and try to pick up something by looking at a bunch of pieces of frames, spend a lot of money, and hope it turns out okay. Well, now you and I have FrameBridge. Here's how it works. Just go to framebridge.com and upload your digital photo if that's what you want to have framed, Or they'll send you packaging to safely mail in your physical pieces. So if you have a piece of artwork or a poster, that you can mail to them, and they'll send you the packaging for that. Preview your item online in dozens of frame styles and gallery wall layouts. Choose your favorite, or if you're not sure about your choice, get free recommendations from their talented designers. The experts at FrameBridge will custom frame your item and deliver your finished piece directly to your door. All you have to do is hang it on the wall. Instead of the hundreds you pay at a framing store, their prices start at $39 and all shipping is free. Plus, my listeners will get 15% off their first order at framebridge.com when they use my code ITCHY. Order online at framebridge.com, or if you're in New York, DC, Atlanta, Philly, Boston, or Chicago, you can stop by a FrameBridge store to work with a designer in person. A patient of mine recently painted a beautiful watercolor piece for me that deserved to be beautifully framed and featured on my wall. So I took a picture of it, uploaded the picture to their website, and used their program to see how it would look using different frames and mats. I chose my favorite combo and mailed the original artwork to them to frame. I cannot wait to see my piece of art in a deserving display. Get started today. Frame your photos or send someone the perfect gift. Go to framebridge.com and use promo code ITCHY to save an additional 15% off your first order. Just go to framebridge.com, promo code ITCHY. Framebridge.com, promo code ITCHY. Most of my listeners know that I'm always harping on the fact that many of us do not eat a balanced diet. As an example, over 97% of women aged 19 to 50 are not getting enough vitamin D from their diet, and 95% are not getting their recommended daily intake of key omega-3s. Ritual's Essential for Women 18 Plus multivitamin helps fill those nutrient gaps and is formulated with nutrients to help support brain health, bone health, blood health, and provide antioxidant support. Ritual invested in a gold standard university-led clinical trial to prove the impact of Essential for Women 18 Plus multivitamin, and the trial showed that vitamin D levels increase by 43%, and omega-3 DHA levels by 41% in just 12 weeks. Ritual just released Synbiotic Plus, a gut health supplement with clinically studied prebiotics, probiotics, and a postbiotic all in one minty capsule. I have started the Synbiotic Plus cap, and I'm thrilled that one cap once daily contains all the key ingredients to promote gut health. Forrest, my son and producer, tends to have some gut issues, and so I am pleased that he has also started Synbiotic Plus. Right now, Ritual is offering my listeners 10% off your first 3 months. Visit ritual.com/itchy and turn healthy habits into a ritual. That's 10% off at ritual.com/itchy. Because for many children, there is often a long delay in getting the correct diagnosis, which I mentioned earlier, the children suffering from amplified pain have often been prescribed a wide range of pain medications, including acetaminophen, which is Tylenol, NSAIDs like ibuprofen, muscle relaxers, ketamine injections, or even opioids like hydrocodone or oxycodone. Children with severe pain have been prescribed implantable morphine pumps. So these kids can even end up with a morphine pump. Unfortunately, the pain meds do not typically provide any relief in their pain. What does work is a combination of daily aerobic and cardiovascular exercise, physical therapy, occupational therapy, and psychological evaluation and consultation to help with coping techniques for the patient and the family, as well as addition of relaxation techniques. There is not a role for medications in children with AMPS, so when starting treatment, typically all pain meds are stopped. The physical and occupational therapy is designed to safely work through the pain and use the affected muscles daily, gradually increasing the intensity and duration of the specific exercises. The first step of treatment for AMPS is reassuring the child that they will not cause damage to their joints and muscles by exercising. Rather, by using their muscles and joints, they will get better. They are so fearful to use the muscle that hurts, and they fear that it will cause further damage if they use it. So a lot of it is just reassurance so that they can get started on this intensive physical therapy and occupational therapy regimen. Oftentimes, these children will come into an AMPS treatment program using crutches or even a wheelchair or walker. They use these aids to avoid putting weight on the affected limb, so as a result, atrophy or muscle wasting is often seen in the affected limb. In treatment, it is important for those aids to be removed as soon as possible. During this specialized treatment regimen, usually one crutch, if they're using crutches, one crutch is taken away on day 1, and the second crutch is taken away on day 2. Within days of this intense physical therapy and occupational therapy, the child is significantly improved. Even those with severe symptoms have near normal function and very little, if any, pain after 4 weeks of intensive therapy. And oftentimes it takes less than that, but children who have really severe symptoms and have been ongoing for a long time often will need 4 weeks of intensive therapy. But the results of this treatment are really remarkable. Before the child is discharged to home, they are given a set of daily exercises to do for a few weeks. Then they are encouraged to start and continue daily exercise activities that they enjoy. So rather than sticking with the exercise list that they are given at discharge, they are, encouraged to take up archery or basketball or whatever they enjoy and do that exercise routine daily. Aerobic exercise is key to manage the pain because it increases blood flow throughout the body and improves cardiovascular health. They are also trained in relaxation techniques to help handle stress and anxiety. The chronic pain these children experience often causes depression and anxiety. Techniques taught include diaphragmatic breathing, imagery, or progressive muscle relaxation. The child is also encouraged to incorporate coping skills like journaling, creative writing, art, and music into their everyday life. Some children with amplified pain are also prone to self-injury. The pain is so desperate sometimes, an injury such as bruising or cutting oneself gives some form of relief, as strange as that may sound. This is an additional manifestation of the psychological distress the child is feeling and needs to be addressed with counseling. Desensitization is also a key component of healing. Rubbing the skin with a towel is one method used to correct the sensitivity caused by the dysfunctional nerve signal loop. So these kids have really, really sensitive skin in the areas of pain, and we're trying to desensitize that skin. By stimulating the skin this way, it really teaches the nervous system how to behave normally. Because this treatment regimen involves using the painful muscles and stimulating the sensitive skin, it can be scary and is definitely painful, but it works. Because these children's lives have been so negatively impacted by their symptoms, typically they are willing to endure the discomfort of the treatment so they can return to a normal life. The Children's Hospital of Philadelphia has a very well-known clinic for AMPS. In their published results of 103 children with complex regional pain syndrome, the type of syndrome with one part of the body affected, 100% became fully functional. 92% became completely symptom-free, and the long-term significant relapse rate was only 15%. At 5 years, 88% were still doing well. And this clinic also gives these children tools and exercises to do if they feel a relapse coming on, so that they can get it corrected more quickly. There are clinics around the country that specialize in the treatment of AMPS. If you want to learn more about amplified pain in children, I recommend going to the website stopchildhoodpain.org, stopchildhoodpain.org, where they have lots of helpful information and a 2-hour video about the syndrome and the therapeutic techniques they use to heal the child. I know 2 hours sounds ridiculous, but it's very interesting, and they show the exercises they use in detail. On this website, they also include a list of hospitals across the country where this syndrome is treated. Again, if you know of a child who is experiencing severe chronic pain that has not been explained by a complete medical workup for the symptoms, consider visiting the website stopchildhoodpain.org for information on how and where the child can be evaluated for AMPS. Many thanks to Ritual and FrameBridge for sponsoring today's episode. Please visit our Facebook page, I&B Podcast, where you can leave more comments or questions. Our website is itchyandbitchy.com. There are blogs with some of our subjects available for you to read. As always, thanks to Forrest Wenzel, our producer and composer of our theme music. Again, check out his album called An Awful Lot. Go wherever you stream your favorite music to listen, and if you don't know where to stream music, you can find the album on Apple Music or Spotify. As always, remember that your health is in your hands. Take care.